Hello everyone, welcome back to my channel. So today we are continue our topic, that is peptic ulcer disease, which we have started in the previous lecture. So what is peptic ulcer disease? It is an ulcer in any part of the GI tract like esophagus, stomach, duodenum, and mostly in lesser curvature. So what is ulcer? Ulcer is an excavated area and discontinuity epithelium. We have an epithelium, and when this discontinuity is present in the epithelium, that is known as ulcer. So what is the difference between ulcer and erosion? Ulcer is an invasion of muscularis propria, but erosion is no invasion. So ulcer can be of two types, acute and chronic, depending on the duration. And fibrosis is not present in acute ulcers but present in chronic ulcer. So what is ulcer? Acid is produced in our stomach, and when this balance of acid is distorted due to any reason, like differencing mechanisms are also distorted, it forms the ulcer. Acid production increases, and to balance this acid production, we have bicarbonates and mucus formed in the stomach under the influence of prostaglandins, which dilutes the acid production and which is responsible for the maintenance of acid or pH buffer system in the stomach. But when there is decreased formation of bicarbonates, mucus due to any reason, or increased production of acid, it leads to the formation of ulcer, and it is responsible for the increased acidity in the stomach. So what is the location of ulcers? The most common part of ulcer is duodenum, that is first part. Second is stomach, which is antrum or lesser curvature. Third is gastroesophageal junction, which can be the adjacent of ileal Meckel's diverticulum. The causes of H. pylori. The causes of ulcer formation can be H. pylori, which is the most common. And in 90% of the cases, duodenal ulcer cases are positive, and in 70%, gastric ulcer cases are positive. So what is H. pylori? It is a gram-negative bacteria which is curved rod in structure, and it can be transmitted through fecal-oral route. H. pylori produces urease, which alters the buffer system of stomach, and it also produces inflammatory cytokines, which is responsible for the inflammation of the stomach wall. It has some genes like VAC-A, SAG-A, and it also produces adhesins like BAB-A, which is responsible for the attachment to the gastric mucosa. And it also produces outer inflammatory proteins. So second cause can be NSAIDs use, which reduces the production of prostaglandins and which is responsible for the decreased production of bicarbonates and mucus. Third can be smoking, or fourth can be spicy food. If we have intake of more and more spicy food, so it will lead to the formation of ulcers. Fifth can be the intake of steroids. So these are the risk factors which can lead to the formation of ulcers. And due to these factors, the risk factor of ulcer formation increases. The presentation of a patient with peptic ulcer disease can be burning epigastric pain, and the most important, it will have relation with the food. Like in gastric ulcer cases, the pain will increase with food, and in duodenal ulcer, it will decrease with food, and the pain will be episodic. Second is we have studied burning epigastric pain, and it will increase in the night time. Most common after 1 to 3 hours after intake of food. We have studied like it will have relation with the food, like it will increase in gastric ulcer and it will decrease in duodenal ulcer. Like if we intake food, if the pain will increase, then it will have gastric ulcer, and if the pain will decrease with intake of food, it will have duodenal ulcer. The pain can be radiated to the backside, left upper quadrant, and can be radiated into the chest. And it will, in the 40% of the cases, patient will present with vomiting and weight loss. Sometimes these presentations can be of silent and can bleed internally. And the patient can be presented with the iron deficiency anemia, sometimes, not all the time. So this much we have studied presentation, we have studied causes, we have studied location, and what is ulcer. In the next lecture, we will study about the complications, management, and the investigation. So thank you.